In these unusual times, telemedicine gives healthcare professionals the ability to evaluate and treat patients from a safe distance. We caught up with Dr. Robert Hong, an internal medicine physician for University of Health Partners of Hawaii, to talk about the benefits of telemedicine care.
Telemedicine is exactly what you think. Seeing your patients using video, or even actually telemedicine can apply to phone calls. Connecting in a remote fashion when it's not possible to see the patient in the office. I'm Rob Hong. I'm the Associate Chief of Medicine at UHP, or University Health Partners.
How are you doing, Primo?
Clearly the main benefit is you don't have the hassle of having to drive to the office, take time off your day, find somebody to drive you in to, see your doctor. It's a lot easier. The other thing that's been great for my patients is I have a fair amount of patients on the neighbor islands. They'll come in, fly in to see me for half an hour and spend a day getting here and back. With associated cost of travel, it's crazy. Using telemedicine and what we call remote monitoring. I'm a cardiologist, so we can follow people pacemaker or implantable defibrillator by using remote devices that blend in, that can tell us a lot about what's going on with them. We can use both aspects of the visual, the remote monitoring, get a really good idea of what's going on with patients and how to treat them. UHP is able to do a variety of telemedicine services, and all our service lines use telemedicine, including internal medicine, where I work, family medicine, OB/GYN, surgery, behavioral health psychiatry. But many providers are able to do telemedicine. Hawaii was one of the real pioneers in telemedicine when the state government decided to reimburse for telemedicine care since the early 2000s. It was slow to take off because the federal government, believe it or not, the Medicare, Medicaid program superseded that, and they said they were not going to use telemedicine. Well, telemedicine supposedly started in the 1950s. But I mean, when you really think about it, telemedicine can be a telephone call. And every time you talk to your doctor on a telephone call, that's telemedicine. If you have questions, you should call your doctor, and they can tell you the easiest way to reach them.
Brought to you by University Health Partners of Hawaii and the John A. Burns School of Medicine.